Imagine a country's entire story, its history, its struggles, its hopes, all captured in the numbers, the flow of its population.
It really is like that.
It's not just how many people, but how they live, how things change, and what it all points to for the future. So today, we're doing a deep dive into exactly that. The incredibly rich and complex world of India's demography. We'll be looking closely at the sources you've shared, covering everything from these big population shifts and fertility trends to the really concerning issue of the sex ratio, and also the government's broad policies trying to, manage it all.
Right. And just to sort of set the stage, let's quickly define demography again. Basically, it's the scientific study of human populations. So looking at changes in size, composition, distribution, and these changes. They're driven by 5 main things: fertility, mortality, marriage, migration, and social mobility. Understanding this isn't just academic theory, it's vital, absolutely crucial for things like community health planning. Because ultimately, a society's health depends on balancing people, space, and needs. And India, with its sheer scale and diversity, it's just an extraordinary case study.
Yeah, absolutely. When we talk population change, it's easy to think it just goes up or down, but there's this concept called the demographic cycle. Though it's maybe less a cycle, more like a journey, a series of phases nations go through as they develop.
That's a good way to put it, a transition.
Typically, we talk about 5 stages: high stationary, early expanding, late expanding, low stationary, and then maybe a declining stage. It helps frame where a country's been and perhaps where it's going.
Exactly. Yeah. And if you apply that to India, historically, it was definitely in that high stationary state right up until about 1920. So picture it: high birth rates, but also really high death rates from famines, epidemics. They basically canceled each other out, keeping the population sort of stable.
Okay.
But then came 1921, which demographers often call the Big Divide.
The big divide. Why?
Well, because improvements started kicking in: better nutrition, public health measures, basic health care, starting to control those big killers, the famines and epidemics. And what's really key here is that these things brought down the crude death rate. That's deaths per 1,000 people per year, much, much faster than the crude birth rate fell.
So that created an imbalance.
Precisely. An imbalance that fueled rapid population growth.
Yeah.
That's the turning point.
Sure.
So fast forward to today, and India's well into the late expanding stage.
Right.
We've seen the death rate plummet. From 27.4 per 1,000 back in 1951 down to an estimated 7.2 in 2020.
Wow.
The birth rate has also dropped. Definitely, but just not as steeply. It went from about 39.9 per 1,000 in 51 to around 18.7 in 2020. And maybe the most telling number is the total fertility rate, or TFR, the average number of kids a woman has. That fell from 3.6 in 1991 to 2.0 in 2020.
2.0, so below replacement level, technically.
Just about, yes. But despite these big drops, the population overall is still growing quite fast, just because of the sheer size and the age structure. The annual growth rate is around 0.89% now, down from 1.64% in 2011, but still significant growth. And another classic sign of this stage, which we see clearly in India, is the rising proportion of older people in the population.
Those numbers paint a picture of, incredible growth, even with slowing rates. And that brings us to that term you often hear: population explosion. It sounds dramatic, but it really signifies this period of rapid overgrowth, causing huge problems: social, economic, political, environmental problems, needing a massive national response. And the scale, when you look at India, it's kind of mind-blowing. You're talking 17.7% of everyone on Earth living on just 2.4% of the world's land.
That density is extraordinary, and it led to a major milestone. India hit 1.21 billion people in 2011, then an estimated 1.41 billion by mid-2022. But here's where it gets really interesting. India officially became the world's most populous country in 2023, overtaking China. That was way earlier than most projections, which put it around 2027.
So it happened faster than expected.
Much faster. And while growth reflects success in, keeping people alive longer, it brings a whole host of serious drawbacks. You see enormous pressure on resources: land, water, food supplies, huge strain on jobs, schools, housing, healthcare, sanitation.
The infrastructure just struggles to keep up.
Exactly. And it impacts the quality of life directly. You see the growth of slums, severe overcrowding, a general kind of deterioration in living standards. Rural to urban migration makes that even worse in the cities. Then there's the demographic burden. Meaning a large chunk of the population are dependents' kids and the elderly relying on the working age population. That puts a huge economic strain on those who are working. It makes fighting poverty harder, investing in health and education tougher.
Right.
And from a health angle, dense populations, often in poor conditions. That means more communicable diseases spread more easily. But India, like many developing nations, faces this really tough challenge called the double burden of disease.
Double burden.
Yeah, they're still fighting the infectious diseases like TB or malaria that developed countries largely conquered generations ago. But at the same time, they're seeing a massive rise in non-communicable diseases, heart disease, diabetes, cancers, the kind of lifestyle diseases common in wealthier nations.
So, unlike developed countries that tackled these sequentially, India's fighting both at once.
Exactly. It's a huge strain on the healthcare system and public health resources.
That double burden really highlights the complexity. Wow. Okay, so to understand these pressures better, we need to look at what's driving the numbers. Let's zoom in on fertility. Just to be clear, fertility means actually having children, right? Not just the potential to have them, which is fecundity.
Correct. Fertility is the actual outcome.
So what are the main factors, the often really deep-rooted things influencing fertility rates in India?
Well, it's a really complex mix of culture, society, economics. First off, there's the universality of marriage. There's still immense cultural pressure for almost everyone to get married.
Right, just expected.
Pretty much. And connected to that is the low age of female marriage, historically. Even though the law changed in 1978, setting 18 as the minimum age, you still find a significant number of married women in rural areas are very young, like 15 to 19. And we know girls who marry younger tend to have more children over their lifetime and also face more health risks during pregnancy.
Has the average age increased at all?
Oh, yes, definitely. The mean age for female marriage was up to 22.7 years in 2020, compared to maybe 20.5 back in 2007. So there's progress, but it's still a factor. Then there's female literacy. This is a huge one.
How so?
There's a really strong inverse relationship. So women with no education average about 3.5 children. Women with, say, 10 plus 2 education, only 1.8 children.
That's a massive difference.
It is. And what's fascinating here is it's not just about family size.
Yeah.
Educating girls empowers them in so many other ways, delaying marriage, better health choices, challenging old norms, participating in the economy. It has this massive ripple effect.
So education is key. What else?
Well, there's the use of contraceptives. Modern spacing methods haven't always been super popular or accessible everywhere. And then you have deep-seated traditions. Things like a strong preference for male children, which can lead couples to keep having children until they have a boy.
The son preference issue.
Exactly. Low living standards, caste dynamics, religion, they all play a role. For instance, Muslim fertility rates tend to be higher than Hindu rates,
Yeah.
though that gap is narrowing. Also, historically, high child mortality made parents hesitant about limiting family size until they were sure their existing children would survive.
That makes sense, tragically.
And finally, the economy. Poorer families often see children as potential future earners, so they might have more. You see this reflected in the TFR being higher in rural areas, 2.2 in 2020, compared to urban areas at 1.6.
It's such a web of interconnected factors. But you mentioned the TFR is down to 2.0 or 1.99 technically?
Yes, based on the latest National Family Health Survey, 1.99 for 2019-21.
So that goal from the National Population Policy, the 2.1 replacement level, India's actually met that. That's a big achievement.
It's a huge milestone, absolutely. A testament to decades of effort.
But even with that success, there's this other really stubborn and deeply worrying issue, the sex ratio. Just to define it, the sex ratio is the number of females for every 1,000 males, and it tells you a lot about a society, influenced by things like different death rates for men and women, migration, and crucially, the sex ratio at birth.
And in India, this ratio has historically been skewed against women, which signals some deep problems. The child sex ratio, specifically for kids aged 0 to 6, is especially alarming. It actually hit an all-time low of 914 females per 1,000 males in the 2011 census. That was down from 927 in 2001.
Down. Even while other things are improving, that's chilling. 914. It represents millions of missing girls.
It's a stark number, a national tragedy, really.
It really raises a critical question. If overall fertility is coming down, why is this specific imbalance, particularly among young children, getting worse or proving so hard to fix? What are the root causes?
There are several powerful, often overlapping reasons. The biggest is probably that pervasive strong male preference we talked about earlier, boys seen as assets, future providers carrying on the family name, while girls are sometimes tragically viewed as a liability, perhaps due to dowry customs or other biases.
A deeply ingrained cultural view.
Very deep. And this can lead to gender inequities and neglect. Girls might get less food, less health care, less education than their brothers, which sadly means higher death rates for them at young ages. Then there's the direct, brutal reality of female infanticide and feticide.
Killing baby girls?
Historically, yes, infanticide happens. Stories of mothers suffocating newborns weren't unheard of. Today, the bigger issue, fueled by technology, is female feticide, using ultrasound to determine the sex and then selectively aborting female fetuses. The easy availability of these tests and abortion services made this much worse.
So technology actually exacerbated the problem.
In this context, yes. There's also high maternal mortality, women dying during pregnancy or childbirth, perhaps linked to marrying young and having many pregnancies close together, also reduces the number of adult women. And other things potentially contribute to maybe some bias in how people are counted in censuses or even trafficking of women. It's complex.
It paints a really sobering picture of deeply embedded societal issues. But okay, given these huge demographic shifts, the growth, the challenges like the sex ratio, India hasn't just stood by. What proactive steps has the government taken? What's the plan?
India's response has been quite comprehensive, using policy and programs. A major framework was the National Population Policy, or NPP, from the year 2000.
NPP 2000, what were its main aims?
It had tiered objectives: short-term, address immediate needs like contraception access, health infrastructure, getting enough trained staff.
Yeah.
Intermediate term, achieve that TFR of 2.1 replacement level fertility by 2010.
Yeah.
As we said, they actually achieved this maybe a bit later, by 2019-21, according to the latest survey.
Right.
And a long-term goal, stabilize India's population by the year 2045.
Stabilized by 2045.
Ambitious.
Very. And the NPP 2000 wasn't just about the TFR number. It set out many other crucial socio-demographic goals aimed at improving quality of life.
Like what? Things like free and compulsory schooling up to age 14, reducing dropout rates, universal child immunization, getting the infant mortality rate, IMR, below 30 deaths per 1,000 live births, getting the maternal mortality ratio, MMR, below 100 deaths per 100,000 live births.
So focusing heavily on child and maternal health.
Absolutely. Also ensuring girls marry only after 18, aiming for 80% of births to happen in clinics or hospitals, universal access to family planning info and services, and importantly, 100% registration of births, deaths, and marriages to get better data.
That sounds incredibly holistic. It's not just population control, it's broad development.
Exactly. It recognized that population issues are deeply linked to overall development and well-being.
So how did they try to implement all this on the ground? What kind of specific strategies and programs have been used?
Well, it's been a multi-pronged approach over decades. The National Family Welfare Program started way back in 1952. It evolved over time, moving towards more of an education approach, trying to motivate people towards the small family norm. Crucially, there's a strong recognition that women's empowerment and boosting female literacy are fundamental drivers of change. They directly impact fertility and women's status overall.
Makes sense, linking back to what you said about education and TFR.
Definitely. Then there's the push for universal access to contraception, offering a cafeteria choice, meaning people can choose from various methods like condoms, pills, IUDs, injectables, sterilization, whatever suits them best. Education programs specifically about population benefit of smaller families, spacing births have also been important.
Trying to change minds as well as provide services.
Yes. And various incentives for smaller families have been tried, like the Balika Samriddhi Yojana, which gave cash support for girl children, or maternity benefit schemes. The focus on improving maternal and child health is key, too. When parents are confident their children will survive, there's less perceived need to have many births just in case.
Right, breaking that cycle.
And more recently, there are targeted programs like Mission Parivar Vikas, which focuses extra effort on districts where the TFR is still high, and things like Nishay distributing home pregnancy test kits to help with early pregnancy detection and decision-making. It's a constantly evolving set of tools.
We've really covered a lot of ground today, from the big picture of India's demographic journey and the sheer scale of its population, down to the specifics of fertility drivers and that critical challenge of the sex ratio. And finally, the complex policy response.
Yeah, and if you sort of step back and look at the whole thing, India's demographic story is really this powerful narrative of a nation grappling with enormous change. You see real progress, especially hitting that fertility goal. That's huge. But the persistent issues, like the sex ratio or that double burden of disease we discussed, they just highlight how complex it remains. The scale of the challenge is still there.
It really is a story of progress and persistent challenges happening side by side. So, thinking about all this, what does it mean for you, listening in, someone interested in global development or how societies change?
Well, it really raises an important question for the future, doesn't it? As India moves forward, managing this unique double burden of disease, dealing with an aging population while still having a large young base, you have to wonder what kinds of innovations are going to be most critical. Thinking about healthcare delivery, sustainable city planning, social safety nets, what will it take to ensure not just survival, but a healthy, equitable, and productive life for all its citizens now and for the generations coming up? That's the big question to ponder.